Patient education. After over 2 decades as a compounding pharmacist, I've discovered that teaching patients is the most important aspect of healthcare. In educating my own patients, I've also learned about providing patients with things like the right kind and the right amount of information, the right kind and amount of emotion, as well as the opportunity for transformation. I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy-to-understand patient education resources. I especially focus on education resources that have to do with hormone levels, how just right hormone levels can transform your life and help keep you healthy for the long term. There are a couple of links in the description below this video. One's for patients who are looking for a hormone optimization provider, somebody who really knows what they're doing with hormones. The other link is for providers who are looking to get new patients. Patient education involves helping patients in a bunch of different ways, helping them understand their health and the treatments that we might want to use to improve their health, helping patients sort of buy into what I'm asking them to do or some kind of action steps, helping patients come to their own conclusions, getting them to think for themselves rather than trying to tell them what to think, offering an empathetic and understanding ear, maybe relieving their fears and concerns, helping patients to understand what they should truly be afraid of and why, as well as what might not be as scary as they might have believed in the first place. Patient education is also about keeping things simple so anybody can understand. Well, all these are essential parts of good patient education. I know because I've really messed up on most of these, going about them in all the wrong ways over the past 25 years or so. In this video, I'm going to get a little vulnerable and tell you some of my biggest mistakes that I've made in teaching patients. I've learned a lot in my decades of patient education that might just help you, whether you're a patient looking for a caring, empathetic healthcare provider, or you're a healthcare practitioner. A little learning is a dangerous thing. In 1709, English poet Alexander Pope wrote that line, "A little learning is a dangerous thing." That principle's been more than true for me. As a brash young pharmacy school student, I started learning a few exciting things about health and disease and drugs, and I also proceeded to diagnose my friends and my family, and I'd recommend all the treatments I thought they should get maybe started on right away. Well, I was just so excited about my newfound knowledge that I just had to pass on what I'd learned to people and help them with it, whether they liked it or not. Except it mostly just made me look arrogant and full of myself, which I kind of was. After that hadn't really worked out so well, I started holding back just a little bit on my overly zealous use of a little knowledge. Whether I have a little knowledge or a lot, it's easy for me to talk over people's heads. I've made assumptions that people can really understand everything that I'm saying and truly get all the jargon and the technical terms that I use. I start throwing around endometrial hyperplasia, or osteoblasts and osteoclasts, or subclinical hypothyroidism, or gonadotropin hormone-releasing hormone. Those big words are important, sure, and they do have their place, but they also often sound like I'm trying to make myself seem maybe better than all the rest of you. Those words end up making me look foolish and like I'm way worse than any of you. The curse of knowledge is where I assume that patients know what I'm talking about and they can see the picture in my head of what they're supposed to be learning. I just can't understand why they don't already know these words and concepts and they end up getting just confused. The curse of knowledge doesn't always come from a place of arrogance. It can also come from a place of honest desire to help people see more clearly, to understand more deeply, to make necessary changes. But if I continue to use overly technical language or medical jargon, I'm not really likely to reach people. I might be more likely to alienate them and make them feel stupid. That's not going to help at all in the long run. The highest form of knowledge is empathy. That comes from Michigan politician Bill Bullard, who passed away recently from COVID-19. Whether it's COVID-19 or politics or religion, empathy sometimes seems to be missing from a lot of our conversations. I know it was missing from my patient education interactions for a long time. When I first started on this journey toward providing clear and simple patient education about optimal hormones, I sort of skipped that part about caring deeply for patients as human beings. Often, early on in my process, I would just jump right into the solutions to people's problems without truly sitting with them in their pain, their suffering, their heartbreak. When I started teaching patients about hormones for menopause, I figured that was exactly what they wanted to hear. They wanted to hear about hormones for menopause. It made perfect sense in my mind. But once I surveyed over 2,500 of those women in menopause, asking them this specific question: what's your single biggest issue or concern when it comes to menopause? My mind and heart began to soften up a little bit with the answers. I have to say that reading some of those responses to my surveys literally brought me to tears. I started developing some empathy for those women who were facing an impossible, desperate situation. They felt like they had really no hope whatsoever, nobody they could turn to for help. My biggest challenge is just not feeling right every single day. It's been going on for about 15 months now. Anxiety has kicked my butt with physical symptoms ranging from shortness of breath, chest pains, some days not even wanting to leave the house. I have never felt like this before. I'm now dealing with acid reflux. I'd be happy with hot flashes and the common things that go along with menopause. I'm 4 months without a period now, and I'm hoping these symptoms cease soon. Somebody else says depression, anxiety, uncontrollable crying, blurred vision, dizziness and ringing in the ears, a feeling of hopelessness. Another woman says, I had a complete hysterectomy in 2010. Life is hard. I have all the symptoms anybody could have. Life is hard. Mood swings were awful. Fatigue, panic attacks, hot flashes, no sex drive, vaginal dryness, no energy, insomnia, depression, and at times I had thoughts of ending my life. Hot flashes all day long, night sweats every day. I only sleep 3 or 4 hours a night, constantly tired, no energy ever. Takes everything I have to make it through each day. Well, these responses, among many others, they changed my own patient education. Now I want to slow down and acknowledge how difficult this must be. I'm so sorry that you've been experiencing this unimaginable loss. It must be so hard to feel like you've lost everything and you just want your life back. I can't really say I understand what this feels like, but it must be very difficult for you. In his first inaugural address, President Franklin Roosevelt said,
So first of all, let me assert my firm belief that the only thing we have to fear is fear itself. Nameless, unreasoning, unjustified terror.
That was his way to instill courage in the American people as they faced the hardships of the Depression. When it comes to patient education, there are some things that patients are going to be afraid of. It's just a natural thing. My job as a patient education pharmacist is to empathetically address those patient fears. In some cases, I have some information that can relieve those fears and make patients feel a whole lot more comfortable with things like hormone replacement therapy. There are lots of examples where the conventional wisdom about hormones has created unnecessary fears. It's my professional opinion that many of those unfounded fears have caused a lot of harm to patients, stopping them from getting what they need. I'm looking to relieve those fears, especially unwarranted fears, by providing clear and truthful education that helps patients understand what's really going on. One of the fears that I'm up against all the time is the worn-out notion that hormones cause breast cancer. It takes about 30 seconds to dispel this unfounded myth. Yet that myth is extremely powerful. It's taken hold in our collective subconscious for about 20 years, and it doesn't seem likely to let go. The idea that hormones cause breast cancer, specifically hormone replacement therapy for women in menopause, that idea comes from a giant study of over 160,000 women called the Women's Health Initiative. The study was abruptly halted in 2002, and it was announced in a press conference, totally unorthodox, that women taking hormones in the study had a, quote, 26% increase in breast cancer. What most people, including doctors, don't realize is that 26% increased risk of breast cancer is really a misquote. The actual increase in breast cancer was 0.08%. I've come to realize that I have a tendency to over-explain things. Less is often more. I tend to go on and on and on in conversation with patients, telling them every little detail. I interviewed a good friend of ours a couple months ago about her experiences with polycystic ovary syndrome, or PCOS. As I was editing the interview, I listened to my own voice droning on and on for what seemed like an eternity. My original intention was to ask a lot of questions and let her do the talking, but I apparently forgot all about that idea during the interview and just decided to lecture her. Fortunately, she's a very patient woman and understanding and gave me some great interview material in spite of my over-explaining. I call my video patient education programs Simple Hormones. It's taken me a few years to get to a place where I'm sharing the simple part about hormones. Hormones are actually pretty complicated. They're, as you probably know, they're chemical messengers that control every system in your body. They have an impact on almost all aspects of your short-term and your long-term health. But most patients don't need to understand everything about the 10 million complicated things all their hormones are involved with. I've made it my objective to teach patients about hormones in as simple and clear a way as I possibly can. I like to use illustrations and metaphors and examples from real life as much as I can. I draw pictures and make animations where it's possible. I'm trying to simplify a relatively complex topic so that just about anybody can understand it, even without any sort of background in science or medical terminology or biology or medicine. There are two questions I'm constantly asking myself these days, even about the videos I post on this YouTube channel. Number one, is it simple? And number two, is it about hormones? I don't want to waste time for patients trying to help them understand all the ins and outs of their hormones that they may not really care about or need. I want to give them just what they need in the simplest possible terms to solve whatever hormonal problems they're experiencing and get their lives back. My main goal in educating patients is less about getting them filled up with information and more about helping to facilitate their own transformation. A woman in menopause doesn't just need information about estradiol and progesterone. She does need that information. It'll be helpful for her. But what she needs even more is to experience a transformation. She needs to move from feeling confused, maybe even hopeless, to feeling confident with a clear path forward. She needs to feel less afraid of her current situation and hormones and feel empowered toward treatment that really makes a difference. She needs to feel like she has her life back again, the way she used to have it. A person who's at risk for Alzheimer's will benefit from information about how to prevent it. Diet, exercise, sleep, avoiding inflammation and insulin resistance. But they'll benefit even more when they're transformed from fearful about the future into moving confidently into long-term health. When they let go of confusion and begin seeing the specific action steps they can take that'll make a difference in their risks. If you're a patient who's experienced less than sympathetic patient education, or who's been overwhelmed with too much information, I may know some providers who might be a better fit for you than the ones you may have experienced in the past. Click the link to find out if I have a hormone optimization provider somewhere in your area. If you're a hormone practitioner and you're interested in being an empathetic, understanding provider who helps the patients I just talked to, I'd love to help you get together with those patients. There's a separate link in the description that'll put you in my hormone optimization provider database. I also have some resources that can save you as a healthcare provider time and frustration in educating your patients. My Simple Hormones patient education programs help you get patients on the same page with you about hormone optimization, and they could save you an hour or more for each new patient. If you found this video helpful, click the like and subscribe buttons to get notified whenever I post a new one. Thanks so much for watching, and we'll look forward to talking again soon.